the Gambia records no new laboratory confirmed COVID-19 case. 5 new laboratory test results received. 4 are new ones, and one of them is a repeat of the 4th case, and all 5 are negative. There is no probable case. 6 additional people are taken into quarantine, making it a total of 67 people in quarantine now. The newly quarantined are 5 Gambians and 1 Senegalese nationals that entered into the country through the land borders. Currently, the country has 6 active cases. Globally, there are 2,088,644 confirmed cases of COVID-19 and 134,754 deaths. In Senegal, our closest neighbor, they record 314 confirmed cases of COVID-19 and 2 deaths as of 15th April. Currently in the Gambia, as we've stated earlier, we have 67 people on quarantine in one of the hotels in the Greater Banjul area. And a total of 307 tests were conducted altogether, and 9 were positive. We continue to emphasize the need for everyone to strictly follow the government's guidelines, and also the need to stay at home to protect our loved ones, our families, and the general public. We are all advised to remain vigilant and to call our toll-free line 1025 for advice or sharing of information. We need to tackle this situation with a collaborative effort and spirit of unity. I continue to reassure you that every arm of the government is doing everything possible to rise to the challenges that comes with the pandemic and ways of defeating it. On that note, we would like to thank each and everyone for the efforts and sacrifices you are making in following the rules on social distancing and guidelines for preventing COVID-19. We want to particularly thank all the healthcare givers and the frontliners for their courage in fighting this battle. Together, we can overcome this challenge. And thank you very much for your kind attention.
Thank you very much, Director. If you have questions, you can identify yourself and your media house. Any question?
Yes, I have one. My name is Pasha Samba, and I work for the Gambian Talent TV. Just like I always say, my question, I want to ask it in Wolof. And the question is, ñetti fan si gannaaw am na benn jigéen bi nga xam ne immigration officer la génne na audio boo xam ne mu ngi round si internet bi xaw ma ndax gis ngeen ko ndax gisu leen ko waaye moom nag wax na ne bokkoon na si ñi nga xam ne ñoom leen wax ne dafa am COVID-19 moom nag wax na si audio bi ne moom daal dañ ko force daal ku ñu test ko waaye daal si balaa ñu ko laata test moom mu ngi jógee si airport bi ñu yóbbu ko Manduwal village foofu leen dente so si biir dente boobu noonu place bi amut ndox amut li nga xam ne moo nekk courant ba pare ñoom 7 leen dugal si benn néeg so ma doon laajte rek balaa ñu leen a yóbbu Bamboo Beach Hotel so ma doon laajte ndax dégg ngeen loolu ak tamit ndax dégg la ne da ngeen dee yóbbu nit under quarantine si benn room 7 nit ak place bi du am ndox ku ngeen wax ci seeni xalaat.
Okay, thank you.
jërëjëf si laajte bi am na solo so baaxut pour suñu waxtaan si affaire yi especially ñuy wax àdduna bi yëpp ñuy wax specifically about nit baaxut ñuy ñëpp mën nañu wax privacy jàmbur waaye ñun baaxut ñu ko def in public waaye laajte yoo fa laajte yu am solo la so nañ ko jéem a tontu in general so bu lii doon xew dëgg la ay security officers ñëwoon neen jógee United Arab Emirates and they were taking dañ yóbbu woon Manduwar so buñ demee foofu because time boobu noonu hotel dafa jafeñ woon and ñu ngi doon am lot of man I was ñu bokkoon naa si ñu doon coordinate loolu am na ko ñu offer woon place ñu yóbbu gars yi foofu waaye buñ demee foofu si following day bi or day after am na complaints yu bari about place bi and then ñu assessaat ko then ñu fekk ñu mun a am beneen hôtel then ñu yóbbu leen foofu that is loolu lu am la so comme lu mu wax noonu lu am la comme like dañ la yóbbu woon benn place comme Mandiwar then ñu gis ne place bi am na ay teexa then ñu jéem koo defaraat yóbbu leen beneen place bi nga xam ne ñëpp dañu am seen room soo gisee guidelines yi mu ngi wane ne lu gën sooy def quarantine lu gën mooy ku nekk am néegi boppam waaye soo amee place bu nga xam ne comme da nga xat amuloo néeg amuloo place boo leen def lu ñoo advice mooy su ñoo nekka su gars yi di nekka boor a bokka benn néeg at all cost kon temps boobu mooy da ngeen war a sori wante minimum of 1 meter lal yi dañ war a sori wante minimum of 1 meter then ngeen a am distancing and all so it's not lu nga xam ne at su teexa amee doo ko mën a def it's something loo mën a def so audio bi tamit démba xam nga barki démba waxoon naa si ne affaire yi feebar comme man affaire dañ cee jànkuwanteel yi so nit ki su meree o mu ngi léegi-léegi dañoo forcé because ñun lu ñoo njëkkaa seet mooy neen try nu ñu waxtaanee yow bañ def test bi waaye su nekkee ne at all cost dañ feel ne da nga war a am test bi waaye yow luñ def yëpp nga ne du am so boobu dañoo def test bi because léegi duñ seetaat yow sa right rek waaye dañoo seet dëkk bi comme man maa ngi am suspect ne dama am feebar bi ñu ñëw wax ma si jeekaa taraanga ne dañ laa test tey dañ bugg a def lii anul waaye ngeen ne déedéet den su dul loolu den dañoo use loi bi lum ñu may ñu def test bi pour man suma famille ak yeneen dëkkandoor yi ak aduna bi yëpp so loolu loi bi moo ñu may doole boobu and then we will use it by ourselves nañ ko mën a jëfandikoo su ko jaree rek waaye maa ngi doon waxtaan fii di wax ne affaire yi feebar ñun ñu bari dañ ko understand gis nga suñ la waxee feebar bu nga xam ne bu ees la te nit yi xamaaguñ feebar bi bu baax te ñu ngi ko ragal torop léegi suñ la waxee ne yaa ngi ko am nit yi nuñ ko dee jëlee dafa utee comme nit su ñëwee ñu ne la baalal ma de waaye ku la ko waxut la nga toog joxut la ndox ay tëb rek ne la danga comme sa papa gaañu na o sa yaay gaañu na gis ngeen si àdduna bi ku nekk dafa am nu mu dee réacté so loolu tamit daf dee mun a xew si façon feebar yi suñ la ko waxee ñu bari dañ doo react dafay daf dee jël time balaa ñu ko accept so loolu leen feel ne moo nekk di xew waaye report si ma nekk di am léegi from the treatment center mooy psychosocial counseling dem na they've done lot of talks with all the people relevant and they are all coming to terms ñëpp ñu ngi ñëw understand what is happening ñu ngi xam lu xew and ba pare ñu ngi cooperate very well léegi daal lu may wax mooy dafa ndooni romanen that level incha allah si faj bi incha allah.
Okay. Beneen bi moo nekk ne how comes ne 47 nit ñoo nekk si mbooloo boobu noonu ay soldat ñi ne police ñi ne immigration waaye ñu ñëw rek tànn ñetti nit ne ñoom ñoo ko si am moom nag jigéen bi wax na si audio bi ne moom dañ ko forcé ku ñu test ko benn test bi ñu ngi ko defee PIU beneen test bi ñu ngi ko defee si biir ambulance bi biñ ko jël si kiram yooyu yëpp moom dafa bañ soo si biir loolu noonu ñu ñëw ne moom dafa am coronavirus moom nag mi ne yéen yi na ko jox coronavirus mi ne yéen seen yi nga xam ne yooyu ngeen nekk di def moo ko jox coronavirus beneen bi nag dama doon laajte yéen naka ngeen a testé ñiti parce que si biir waxam mi ne dañ dee jël pipe ak li nga xam ne mooy witeen ñu dugal ko si sa bakkan bi loolu am na ndax amut parce que askan bi jamono ji ñu ngi jaaxle si naka ngeen dee testé.
ok
thank you.
so jërëjëf duñ dee ñun si suñ liggéey amul kenn ku nga xam ne jox neen la coronavirus because bagage yi ñoo use yëpp dañ stérile luñ stérile mooy da nga xam ne dañ ko test bi nga xam ne dafa ëppa comme set nii rek comme suñ raxasee dafa stérile mun nañ koo dugal even si biir yaram mi te du la jox feebar so bagage yi ñoo use yëpp dafa stérile te luñ wax dégg la comme luñ dee defee test bi noonu la test bi am na léegi report yi wane ne di leen dee mun a use deret waaye for now test bi nuñ ko dee gën a defee mooy throat ak swab dañoo jël swab si biir bakken bi ak nga ŋaang ñu def ko si biir ñu jël swab bi noonu leen ko dee di gën a defee wala ñu jël xaqandeku so ñaar yooyu leen dee gën a use pour def test bi so noonu leen dee defee test bi pour nga jël ko moo tax dafa xaw a dangerous pour because si lungs si la dee gën a nekk si respiratory system bi la dee gën a nekk so foofu nga ko gën a mun a amee te du invasive noonu parce que soo amee ñaari façon test nga mun koo jël si xaxandeku wala nga mun koo jël si throat swab moo su nekkee loolu mun na ba pare te nga mun koo jël si deret da nga préfère bu less invasive comme bu nga xam ne doo jam nit ki doo def many other things te doo ko lor like comme soo amee ñaar yu bon nga jël bu gën a ndaw si yu bon yi so noonu la mel su nekkoon ne test bi you can use the blood you can use the sputum you can use te yëpp ñu ngi am the same level so da nga gis ne noonu la waaye even bi di test bi sax dañ doon wane ne léegi la blood bi di ñëw sax before ñu ne bële moo gën a baax pour mun laa jox good result so noonu la ñu defee test bi thank you.
Okay, any other question? Yes, identify yourself and.
Now, doctor, looking at the situation of social distancing in this country, it is not highly respected. And based on this, also experts or their opinions that Gambia is likely to see cases in thousands in the next coming months. So, are these opinions substantiated by research or the trend of the people's behavior right now? And if the cases happens to go up, is this country really prepared for thousands of cases?
Thank you.
So the modelings, like we said earlier, is underpinned by science. So it's not just guesswork. Basically, it's an estimation, but there's a lot of assumptions and mathematical methods utilized to come to that conclusion. Because you don't just also sit down and plan in the dark like that. It's difficult. You have to work with something based on, but we have to understand that it's estimates. So there are different models. And the one we are working with most is the one that talks about if there is no social distancing, and is done by people we know, very renowned professors. And talking about if there is no social distancing, you're having about 181,000. And if there's social distancing, you're having about 53,000. And at the peak, because all these epidemics will have a peak and then come down. So at the peak, without social distancing, they were thinking that we might be needing up to 3,300 beds. And with social distancing, probably 1,000. So these are things we are working with, and we are preparing based on that. And, the way things are going, based on the estimations we are working with, the number of cases we should have been having today, we are far, far from that, based on the estimations. So I think we will encourage people to continue to work hard so that we don't have those estimates. We are preparing for the worst, but as of now, we don't want to rest on our laurels, but we should hope and pray for the best. Yeah, so that's how it is. We are preparing for this worst case scenario, and that's why there are a lot of treatment centers we are identifying. We are trying to put in some structures that are makeshift, just to prepare. We are ordering a lot of beds right now. If you go, we've received so many beds. We are trying to get mattresses. As a ministry, that doesn't mean that we are pessimistic or we are praying for bad omen or something, but it's just preparation. We are preparing for the worst. But in our hearts and in our minds, we are praying that we don't have any more cases tomorrow. So I'm surprised when I hear people thinking that if Gambia has more cases, the government gets more resources. That's nothing that can be further from the real and the actual thing. Because every day we are praying that we don't have any more cases. But every day we are preparing for the worst case scenario also. So thank you.
Yeah. Last question. Okay, yes.
My name is Fatou from Georgia. I intend on going a little bit financial. I'm sure you've had this before in regards to the debt relief, and that the Gambia is also part of the country's been relief of their debt in regards to the IMF and the World Bank. But also I want to, because I do know you are aware of the fact that the IMF has already given part of the extended facility loan, some part, which is about $12 million, if I'm correct. And this morning also I saw the news about $21.1 million, which the IMF is also giving as part of the credit facility loan, a rapid credit facility loan to be precise. Now we're aware of all these resources being about to be injected, or some even being injected. I'm not sure how you're ready to go about this part of social spending, or what ways are you willing to strategize in terms of how you allocate these resources, and what would be the sectors that would be the primary focus? We spoke to the Red Cross this morning on our AM show, and we're aware of the fact that they're not receiving any sort of direct support from the government, and they're in the midst of this pandemic in terms of how they, receive cases and how they transmit these people as well to the hospitals. What will be your take?
Okay, thank you very much. Director.
So, thank you very much for the question. It's a very difficult question for me because it's mostly out of my realm, and I would say sorry about this, but I have to get further information, mainly from the Minister of Finance, because they are basically doing all the calculation in that regard. And we are working as a team, as a government, but my answer will not be very detailed. So we're sorry about that. We'll try to get it maybe next time from our colleagues.
Do you have plans as to what you think as a Ministry of Health, because you are definitely dealing directly in this pandemic, even though I'm aware of the fact that the Ministry of Finance is of course going to be in the midst of the resource allocation and has to budget for everything and make sure accountability is at the peak of it. But do you have like areas as a ministry which would be also your focus in terms of how you would want this resource to be allocated, even though it's not about health also, but we have other areas that need to be factored?
Yeah, so very good. For health, we are interested because health is not just the absence of disease, it's the total well-being of the individual, physically, mentally, psychologically, and all. So if somebody is not sick, doesn't mean that he is not healthy. So yes, we are interested in people having, because we don't want also people not to have the coronavirus and then die of hunger, or die of other illnesses, or die of lack of food. For health, what we are interested in, nobody dying, nobody getting sick. And so we are going to work, we are working very closely with finance on this. I'm just deferring it, not that I don't know anything they are doing it, but I'm deferring it so that you can get a more accurate and detailed answer. But we are working dovetail and very close to see how these things. We were in the National Assembly, and these were the questions they were asking. They are also very interested in that. For the health one, I can tell you that, like the minister has said, where we are putting the resources, mainly in procurement of equipment, we are paying all these hotel bills, but the key thing that is taking most of the resources is equipment. We are buying a lot of equipment, ambulances, and all those things are already being procured, and more are being procured. Now, the difficulty with procuring these things now is quite different. We are in abnormal times, so what is happening is, even if you have the money and you want to buy it, sometimes some countries are giving restrictions. You buy it, and you have to appeal, you have to write for clearance and all that, so that they can allow you to leave their country. Depending now, the way you buy things, there's also friendship. It's not only the money, but also because you need it, America need it, and other countries need it, and if they value it, maybe those people are dying more, and so the country might say, no, all these ventilators, we cannot give it to Gambia, let's give it to America. They have a higher death rate now, or they have this or have. So, but I can tell you that the procurement is going on. It's not easy. It's an abnormal system of procurement now we are going through, but most of the resources are going on equipment and consumables, protective materials, and all that. Then some of it now will be utilized here for other systems. So, thank you.
Yeah, this will be the final question. Yeah, the final one.
We've seen that around the world, lawmakers are taking advices from medical personnel and scientists to make decisions. And in Gambia, most people are talking about this 45 days. And I'm personally thinking with the advice with you people, it's only you people who can advise the government and the people whether we are going to do more than 45 days or 45 days. And another thing is, do you have a plan that, is there any plan that we are going to contain this virus, that people can go back to their daily lives and without risking the virus being spread? Or are we just going to wait for the whole problem to be solved internationally so we can get back to our businesses?
Okay, thank you. I hope this will be this is the last question. Doctor.
So the way you talk about this, so this is an existential threat. It's a serious thing. And that is the advice we have given to the National Assembly, that this is about remaining as a country as we are. That's how serious this is. We should put all efforts to ensure that it doesn't enter the country. So a proposal was made, and the National Assembly are also representing people, and they know what the people want, and also they are talking from their constituency, and they came with their proposals that they agree with us. They agree that this is an existential threat and all, but they also want to see some other things in place before they can give this type of thing. If you ask me, if you ask us as a health ministry, we would want this enforced yesterday. You know, we would want this enforced yesterday. But they are also looking at many other things. Like we said, that you don't want to stop people from having the virus and then dying from something else. But you know, we are in that type of a situation, because this virus, the way it is spreading, and this world now is a global village. You know, what is happening in America in the next 6 hours or 10 hours could be in Gambia. So it's good we take it like that and take it very seriously. Until pandemics usually have a course, they have a time duration, and it's like they go like that, a crescendo. So we are thinking that until that happens, we should take this disease very seriously and ensure that I'm speaking Wolof, we do everything possible to ensure that it doesn't enter the country.
Yeah, thank you very much, colleagues, for your patience. Once again, we apologize on behalf of the Minister of Health, and we sincerely apologize. And for your information, as the Honorable Minister mentioned earlier to you, some of his cabinet colleagues will be joining him for the daily updates. Thank you.